Now, the resident doctors who have been protesting for weeks and months now over the NEET PG counselling issue have threatened mass resignations. In a release, the Federation of Resident Doctors Association of India said that they have been forced to consider this step since no concrete measure is being taken by the Union Health Ministry on expediting the NEET PG counselling, which would in a way add more doctors into the system and hence reduce the work burden. Remember, doctors have been protesting at the doorstep of the Union Health Ministry for the past 5 days in a row. Let me go across to my colleague Ayushman for more on this. Ayushman, so at the moment, of course, the doctors have come out with this press release essentially saying that they are going to consider mass resignations since there's been no action yet. The centre has been completely mum as far as this particular leg of the protest by the doctors is concerned. What exactly are the doctors planning in terms of the steps they are taking, after they have in fact come out with this press release saying that there could be mass resignations from the coming week onwards?
Well, good morning, Tanima. If you look at the FORDA statement, they have threatened to go for mass resignation from services. And today we are being told by Federation of Resident Doctor Association that about 2 p.m. they are going to have a meet pan-India with all the resident doctor associations across the country. In that, this matter of expediting the NEET PG counselling and the government's somewhere inability to expedite the entire process in Supreme Court, that application has not come, and then and also there has been no communication from centre will be discussed. But what we are being told by the Federation of Resident Doctor Association is that the modalities will be finalized as to how the mass resignation will go on Monday, because they want to do it at one go across the country so that all those resident doctors who are working for over 30 hours, they will be submitting their resignation to the concerned hospital authorities pan-India, so that somewhere the centre recognizes the gravity of the situation. Because till now what they have been told is that minister's assurance has come from verbally, but nothing sure has come on written, and that is why these doctors, after protesting for over 7 days in the second leg of their protest, are now being forced to resign because they cannot continue to be overburdened and overworked.
Ayushman, thank you so much for joining us with that. I'm also joined on the broadcast by Dr. Rakesh Bagri. He is, of course, one of the doctors who is supporting this particular strike, which is currently on. Dr. Bagri, what we can, in fact, look at the moment that this is a very drastic step. What exactly do you mean by doctors are considering mass resignations?
Yeah, actually, this is a very big steps for us residents, to give mass resignation. So yesterday, FORDA has talked with other state RDAs and other state representatives, and came with this point to give mass resignation, so that there will be a huge impact for this ongoing protest. Today's also the last meeting, last time meeting will be organized in afternoon. Then the FORDA will plan how to apply this act. So we'll be waiting for their result, so that we can apply this how to.
Right, Doctor. My question was about the specifics. I mean, I know there's a afternoon meeting that is lined up for you, but at the moment, do we know whether this is specific to Delhi doctors that you're looking at? There are 3 government hospitals, big government hospitals, where doctors have been protesting for the past several weeks now. Are we talking about those particular doctors, or is it going to be a nationwide mass resignation that you all are considering at the moment?
Actually, the current going protest is mainly in the 4 government hospitals, not in 3. Mainly 4 government hospitals, center government. So the majority of residents are ongoing in these strikes. But recently, a few RDAs from other states also have joined with the ongoing protest. So if all thing will be cleared after this meeting, then these are the main doctors going on mass resignation.
Dr. Bagri, do you think that this is going to actually help in any way? Isn't it better to actually try and get into some sort of a dialogue? I mean, after this press release which came out last night, has there been any effort from anyone from the centre, from the Union Health Ministry, in terms of reaching out and ending the stalemate that we are seeing for weeks now? Because let's remember that, unfortunately, one of the aspects or the fallout of this stir is also the patient care being hit so drastically in Delhi, especially a lot of patients who have in fact been coming to these big government hospitals in Delhi that you're talking about. They are being turned back, returning disappointed. So that is an aspect that you as a doctor will have to keep in mind if you're looking at mass resignations like this.
No, definitely we have going through these points all the times recently from past 1 year. But this is the need of the time, no? Because if we see the ongoing third wave, so there will be a huge lack of doctors. If we see if third wave is coming, so there will be need of such doctors. So government should definitely try to get this doctor as much as get possible. So this is I know there will be some problems of patients you are talking about, but in the long term effect, if you see, there will be huge impact of these doctors if they are not present. The 45,000 specialist doctors are not present in the upcoming situation. There will be there can be a huge loss to the nation and the country. So it is in the interest of the country. So we are
Right.
thinking at that point.
Okay. So that is, of course, we'll have to wait and see what is the final outcome in terms of this. At this point in time, the doctors are considering, they've threatened mass resignations. There's an afternoon meeting lined up when the Doctors Association might come up with a concrete decision. Dr. Rakesh Bagri there, thank you so much for joining us on the show today.